talk very briefly about cervical and less even about ovarian cancer, just a general background on it. Cervical cancer incidence, and the main point from this slide is that the incidence is decreasing. The biggest thanks to that goes to Dr. Papanicolaou, who is the namesake of Pap smear. A good screening test is inexpensive. It identifies the cancer in a curable or pre-malignant state where something can be done before the cancer develops. And it needs to be low in its false negatives and false positives, meaning we don't want to inadvertently alarm people and scare them that they may have cancer when in fact everything is normal. And we also don't want to ever miss any cancers. The little image up in the corner is actually what a Pap smear would look like. It's cells that are spread out onto a glass slide, and a pathologist looks under a microscope at these. Cervical cancer, fortunately, has a very long pre-invasive state, which means that from infection with the virus or development of a mutation, it may take many years, 5 to 7 years, for this to develop into an actual clinical cancer, which leaves a lot of time for screening and development. The majority of the patients that we treat with cervical cancer are patients who have just not been doing their screening for various reasons, and often reasons beyond their control if screening is just simply not available to them in their community. General slide just looking at lifetime probability of developing cancer for all sites, 1 in 3, which is a pretty sobering statistic. I've highlighted breast, endometrial, ovary, and uterine cervix to give you a relative idea of how common these are. HPV, or human papillomavirus, is the causative agent in about 85% of cervical cancers, but not all people who have cervical cancer have human papillomavirus. The virus actually inserts a false message into the healthy cells and then hijacks those healthy cells to produce more copies of the virus, thereby infecting adjacent cells. The clinical presentation for cervical cancer, if it's not from the Pap test being abnormal, then bleeding again is the common problem. Abnormal bleeding, particularly after menopause, should always be addressed. So cervical cancer, the earlier the stage, the better the chances for cure. If the cancer is caught very early, you don't have to go to the length of a hysterectomy. If the cancer is more advanced, then radiation and chemotherapy come into play. Cervical cancer summary, the screening improves opportunity for early detection. Early detection allows for treatment at an earlier stage. Treatment at earlier stage allows for increased cure rates. Less invasive surgical techniques mean that the patient survives the cancer with their normal quality of life as nearly intact as it can be.